I'm Ms. McLaughlin, and welcome to our dermatology office. I'm just going to go over a few things with you about the surgical procedure that you'll be undergoing today. It's very simple and quick, and there's nothing that you should be worried about at all. If you have any questions over the course of the time we are discussing the procedure, please feel free to ask. So the person who will be performing the surgery is a dermatologist by the name of Dr. Mark Davis, and he has done many procedures like these before, and he will make you feel very comfortable while in the operating room. First, I would really just like to discuss with you exactly what kind of cancer you have and how it most likely came about so that we can begin discussing preventative methods as well. As you know, you have basal cell carcinoma. This is a type of cancer that usually grows very slowly and often does not show up for many years after intense or long-term exposure to the sun. So basically, when the UV rays from either the sun or a tanning bed hit your skin, they damage your DNA that is inside your skin cells. This DNA holds the code for the way these cells grow, and damage to these over time is what causes the cancer. It's usually characterized by some small bumps that can appear to be the color of your skin tone or even much darker. Usually there will be shiny pink or red patches around the area as well that can kind of help you see what they are. So in order to get rid of the cancer cells, we will be performing Mohs surgery on the skin above your zygomatic arch, which is your cheekbone. This procedure is considered to be the most effective for treating basal cell carcinoma, so that's a really good point. The procedure involves removing one thin layer of tissue at a time and examining each one under the microscope. To put that more simply, first the surgeon will numb the site of the carcinoma with anesthesia. Once your skin is feeling pretty numb, the area is gently scraped with a semi-sharp scoop-shaped instrument, kind of like a scalpel. The dermatologist will begin by scraping away one layer of tissue. The tissue sections will be processed and then examined to thoroughly evaluate any evidence of remaining cancer cells. This procedure will take about an hour, give or take, depending on the amount of layers the doctor will need to scrape away. It's a pretty repetitive process, but we really want to ensure that all of the cancer cells are removed. So during the processing period of the tissues, your wound will be stitched and bandaged up, as you can expect to have some bleeding as well, and then you'll be able to leave the operative site. This process will include some stitches, like I just mentioned, so there will be some keep up on the area that you will be responsible for. Every 24 hours, you will pat the area of the skin dry and apply a film of ointment, such as Vaseline, and then rebandage the area. It's important that you do not immerse the wound underwater until a week after the stitches have been removed. You also want to keep a good eye on your skin for any symptoms or signs of cancer. Also, avoid being in the sun for long periods of time and always wear sunscreen for protection. Sometimes you may need to wear a hat or a shirt with long sleeves when exposed to the sun, just as an extra preventable measure. As with any treatment of skin cancer, this procedure will leave a small scar. Thankfully, Mohs surgery preserves as much healthy skin as possible and maximizes your options for repairing the surgical defect, which is something we can discuss at your follow-up appointment if you wish to. You may also experience some bruising and swelling for up to a week after surgery, and that is normal. So if there are no further questions, we can go ahead and schedule a follow-up appointment so that the dermatologist can check on the healing process and also to remove the stitches. The doctor will need to see you back in the next 7 days to check your progress and make sure that no infection of any sort has emerged.